Okay, we'll welcome back. We'll make a start. Let's see. Our timekeeping is well. I don't think we'll talk about our timekeeping, but anyway. So, I hope you all enjoyed your lunch. I think it's a very good opportunity, as I saw, for you to go and just mingle and find support and ask questions and just realise that you're not on your own going through this. As you heard earlier on from both Seamus and from John, the whole area of advocacy and calling out some of the issues and calling out some of the tough questions that need to be asked is a very important part in the fight against cancer. And while providing a community support within OvaCare is one of our core objectives, being your advocates and being the advocates of the medical community in terms of being able to ask those difficult questions or ask the questions that in lots of cases the people who operate in the system aren't either allowed to or unable or are neither enabled to ask the question. So we get those opportunities to go and ask those. Right? And to tell you a bit more about the advocacy work that we've done in the last while and what we are doing and what's to come from an OvaCare point of view, I'd like to ask Dr. Sharon O'Toole to come in and give you a quick update. Sharon is chair of our medical panel and she's one of the founding directors of OvaCare as well. So she's going to tell you exactly the kind of stuff we're doing from an advocacy point of view within OvaCare. So big welcome for Sharon.
Thanks. So as Brian said, I chair the medical panel for OvaCare. I'm also a scientist in Trinity College working in ovarian cancer research. And I just thought it was important because a lot of, on the OvaCare blog recently, there's been a lot of talk about awareness and about getting the symptoms out there on ovarian cancer. And I just wanted to update you probably a bit because 2 years ago, the 3 ovarian cancer charities in Ireland got together. So there was OvaCare, the SOC, who are about promoting awareness, and the Emer Casey Foundation, who fund research and also have funded the clinical nurse in Cork. The 3 got together with some clinicians in Dublin and just talked about what can be done maybe to improve diagnosis and treatment for ovarian cancer. And one of the things that constantly came up and comes up at our meetings all the time is that women are misdiagnosed or that their symptoms are being, the GP says, oh, it's irritable bowel, and they've been treated for irritable bowel syndrome for a long time before they're actually diagnosed. So we wrote first to the National Cancer Control Programme, and they informed us that there were guidelines for ovarian cancer that were due to be issued to GPs. So these guidelines, unfortunately, have been sitting on a desk for the last 2 years and still haven't been issued to GPs. So in the meantime, we have had numerous meetings, and we've gone now to meet with the Irish College of General Practitioners to know why aren't they releasing these guidelines to the GPs. And one of the things that has come up is that GPs around the country do not have access to services. So a GP in the north east and northwest cannot order a CA125 or cannot order an urgent ultrasound for a patient. So I'm happy to report that from yesterday, we just got an update from the National Cancer Control Programme to say that these issues with services were going to be sorted. And also just to say that the Irish College of General Practitioners have agreed on World Ovarian Cancer Day to release a position statement on ovarian cancer with the charities. So this will act as an education tool also for GPs in the interim while these guidelines are being rolled out. And they have also agreed to do a pilot study on the guidelines in St James's Hospital in Dublin. So hopefully within this year, we're hopeful that within this year the guidelines will be released. And we're hoping that this will lead to cancer has been diagnosed at an early stage, because we know if they're diagnosed early, there's a 90% cure rate for ovarian cancer. So that's just one of the issues. And just to say, we have been working on that in the background, and I know it was coming up in the blog, so I felt it was important to let people know that we are, and I know some patients have actually wrote to the Minister of Health to talk about this, and I think all the pressure, it has helped. We've been told by the National Cancer Control Programme that us, keeping it on the agenda all the time has helped move this forward. So I think any letters or any stories that need to go out there is important as well. So on World Ovarian Cancer Day, which is happening on May the 8th this year, There will be events in Dublin. I know the Mary Keating Foundation are going to run a wellness morning, and they'll have some speakers at that, and we can advertise that once we have the final details. The Emer Casey Foundation are having a charity lunch in Dublin, and we're hoping that some events will be organised in Cork. I know the daffodil centres around the country have also agreed to promote ovarian cancer on the day, but we do agree there is a need to have it not just a day for ovarian cancer. We need a month like some of the other cancers get. And, you know, we need to pressurise the Irish Cancer Society as well into helping us promote that and developing it more into a wider awareness campaign for ovarian cancer. But if you want to organise events locally, we're happy to send you any material on OvaCare, to send you some of the teal ribbons to help promote awareness of symptoms on May the 8th. So that's all, just to update you on that.
Thanks, Sharon. So we're now going to have a patient story. And again, we had Sinead's story this morning and the art workshop. Sinead just said to let you know that she sent her apologies. She had to go. She's tired. She's suffering from the tiredness that John Calder spoke about earlier on. And she said, look, please make sure that you all realise that her intention was to stay for the day. But as you can imagine, in her preparation for this morning and in running this morning, it was quite tiring. And I said, look, of course we'd understand. But she just wanted to make sure that I would mention the fact that she loved this morning. She thought there was a great calmness in the room when it was going on. As she said in her homework, she said, I just loved the atmosphere in the room. So that's Sinead. So that was Sinead. And now we've got Joan Moore. So if I could call on Joan Moore to come up and tell her story. So Joan. Joan is coming prepared, water and everything. Very good. Excellent.
Right. Before I start, I just want to say that I'm delighted that Sharon has the news that people, or that the Irish College of General Practitioners are going to promote the symptoms of ovarian cancer among their patients, because it's one thing getting a pamphlet on your diagnosis, but we need to get the information out there before diagnosis. Right, so my name is Joan. I was trying to put a few words together as to how my diagnosis came about, and two things struck me: how I have changed and how the health system in this country has changed. When I attended my GP at the end of 2005 with pain and a swollen tummy, after one call, I was on my way to be admitted to hospital for urgent care and attention, and I was indeed admitted without any delay. In today's hospital climate, I may not be so lucky. The second thing is that back then I certainly wouldn't have considered speaking in public to a lot of people. So, back to my story. Shock and horror. I had never been in hospital before, apart from bringing my parents to clinics and visiting people. So I succumbed to blood tests, scans and everything else. My CT scans showed my problem was a gynae one, so I was referred to a gynae consultant. I was lost in this foreign world and my life was suddenly spiralling out of control. The gynaecologist confirmed I had a huge mass which had to be removed, so I was sent home to return in a few weeks for surgery. I was devastated. I always remember the advice a colleague gave to me. She said, go with the flow. It's easier, so that's what I did. In July 2005, I had my first surgery. Things didn't go really well. The wound wasn't healing, so I had to be readmitted to get IV antibiotics and then attend dressing clinics for weeks. The results were borderline. So I was informed that further debulking was needed and I would be called back to complete this. So a year later, second surgery occurred. It may sound strange, but I didn't complain about weight. I suppose I was in denial. The second surgery went okay, but a fragment of the ovary was left because it was near a major blood vessel and was too dangerous to remove. This time the results were clearer. I had this instinct all wasn't well, so I asked the registrar straight out one evening on his rounds, and he had to tell me that the result was malignant and I would need chemotherapy. I was upset, but I think he was more upset. So I returned for my 6-week check-up to find the chemo was indeed on the cards. The treatment was to be carbotaxol, and I would lose my hair. I made the decision then to lose the hair in my own time and set about finding a wig supplier and hairdresser. The carbotaxol was a hard treatment, but I decided to make it harder. I was out sick from work, but decided to complete a part-time course I was doing in credit union studies. I was lucky. I had a very encouraging college tutor who gave me great support. So I finished the chemo and thought, well, that's done. I can get back to normal. I returned to work. In 2009, 2010, I wasn't feeling very well, but my CA125s were normal. I had backache and a sore bum, and after a few months was discovered that this cancer had decided to visit me once more. My oncologist told me the disease had spread somewhat, so in May 2010 I started GEM and carboplatin. This wasn't as debilitating as previous regime. I had 6 rounds of this and got a better result than expected. So I got another break, and then the little bugger again came back about 15 months later in a small area, so I was sent for radiotherapy. I tolerated the radiotherapy fairly okay just by being careful and balancing the fibre intake. In September 2013 it returned again, so I had 6 rounds of Gemzar and Avastin. I finished Gemzar over a year ago while remaining on the Avastin. That's one of the targeted therapies that Professor O'Reilly was talking about earlier on. So I get that every 3 weeks. For me, the Avastin has given me no great side effects apart from sinus problems and tiredness, and as you notice, a little bit of hoarseness. I reduced my working hours to 12 hours a week. Probably a better idea to get out of the house and stop negative thoughts. I am now almost 10 years down the road, as previously mentioned. I am extremely lucky to be talking to you today. I look forward to retiring from work in May, another milestone I thought I wouldn't reach. My GP, who retired last year, informed me I am unique and that I have kept fighting this disease. During treatment, I've had bad days and fairly good days. I've managed to get away for little holidays. I've learned that anything you can do to get your mind refocused is a good thing. I have good family support and good friends. You do lose friends on this journey because they can't cope with your illness, but you also make new friends. I have a little grandson, Callum, almost 4, and I love him to the moon and back. When he was born, I was afraid to get too attached in case I wouldn't be here for him now. During my second chemo, I lost twin grandsons born at 26 weeks, so life hasn't been easy along the way. When you're on treatment, there's always other stuff going on in the background that control you. No one ever said life will be easy. OvaCare has been invaluable to me because it has helped me to meet with other ladies on the same road as myself, and you feel very much at home at the coffee mornings or information days. I find my friends and colleagues understand a certain amount of what you go through, but not all of it, so that is why I find you can empathise with those going through treatment more if you're going through it yourself. ARC Cancer Support House has helped me immensely also. I do get negative thoughts from time to time, so they're put to rest there. I also have enjoyed many reflexology treatments down through the years. My third outside support is Bravehearts Choir, which is a choir which was started over 2 years ago for cancer patients, family and friends. Originally the idea stemmed from a Galway oncologist who joined a choir and found it therapeutic for himself, so he decided with some help to start a choir for cancer patients, so it spread nationwide, worldwide. We were formerly known as Something to Sing About, but to gain more members we extended it to family and friends, so Cork being the rebel county, we changed the name of the choir to Bravehearts. We meet on Wednesday nights at the Student Centre UCC. Men and women, welcome. I have a fantastic oncology team at the South Infirmary Victoria Hospital who have been so kind and helpful to a sometimes bewildered patient. To Professor O'Reilly, I wish to say a big thank you, which sounds a lot better than my last comment when I was visiting him when I got the result of the scan. All he got was one word, was really. Any of you who attend the South Infirmary for treatment will agree with me that the nurses there are extremely hard-working and efficient. To finalise, having recurrences is difficult because at times you see no way out, or as others have described it, it's like being on a merry-go-round you can't get off. All the material things cease to matter, and you learn not to worry as much about stupid things. To relax, I like to read, walk my dogs, do a bit of gardening, or get away for a short break. So, may I leave you with this thought from the late James Heaney. Even if the hopes you started out with are dashed, hope has to be maintained. Thank you, ladies and gentlemen.